All right, so I just finished up your clinical assessment, and I just want to know where you're at with gum disease. Have you heard of it before or been diagnosed with it before in the past?
Yeah, about a half a year ago, I went to see a dental hygienist, and she did deep cleaned about half my mouth, and then she
Hmm.
told me about gum disease. I never was able to finish the other side because I was too busy at the time.
Okay, awesome. Well, I'll just touch briefly on it then. So the gum disease is caused by bacteria in your mouth. The bacteria is what gets in between your gums and your teeth, and it causes them to be inflamed and irritated, and that's when you would have that inflammation. The inflammation is the kind of that sign that your body is trying to fight off the infection, and then it accumulates just minutes after you brush your teeth. So um, the tooth surface is really a place where the bacteria thrives and grows, and that's why it's so important to keep up on good oral hygiene, frequent care visits, just because it starts off as that sticky biofilm of plaque, and then after over time, if it's not removed, it becomes calculus, and that's something that you have to is only removed with instruments and not just a toothbrush in itself. And the bacteria and plaque start to produce toxins, and that's definitely the main cause of periodontal disease is those toxins and your body's response to the toxins. And that's what destroys the bone levels around your tooth. So in the early stage, when your teeth are healthy, the gums are snug around the tooth, you don't see any inflammation, pink, normal color. Gingivitis is when things are starting to become, your gums are becoming inflamed, it's getting irritated, redness. Probing depths are still in that 3 range. Anywhere from 1 to 3 is healthy. 3 and above is when we get concerned for the bone loss levels. And then what I diagnosed you as having is the generalized chronic severe chronic perio, and that's with you have severely deep pockets, bone loss, redness, inflammation, exudate, which is pus. And you said you bad breath as well. Those all signs of that. Um, uh, Before this is why it was important to get this stuff catch it early on, because it is an irreversible disease. But there is some stuff that we can do. We can do scaling of root planing, as which you had a year ago,
Mm-hmm.
and this is we use an instrument to get deep into those pockets and remove the tartar and buildup that's causing the inflammation, and prevent further progression of the disease and bone loss. This can be caused by systemic conditions and smoking, which you do not have a systemic condition or smoking, but can be caused by local risk factors such as stress and trauma, um, age, all of those things as well. And then as also your oral hygiene habits at home, and then frequent, how often you're going in for those cleanings and all that kind of stuff.
Mm-hmm.
So, with the first step being that you would come in for the SRP treatment. It's an extensive procedure and it takes a lot of time. So, the first appointment, we would do the right side of your mouth, and that would take 4 hours. So, we do quads 1 and 4, and then for the second appointment, you would come back. We would do the left side 2 and 3, and that would be 4 hours as well. And then it could be the potential for more appointments as well. Just want to let you know that right away, just in case you might need to come back again. And then there is also the tissue check in 6 weeks, where you come in and we check the tissues to see how you're responding to treatment, and then to reprobe your pocket depths and see where you're at. And then after that, since it's a disease that you have for life, you would have to come in for perio maintenance appointments, and so that would be every 3 months, and those appointments would take about an hour.
Okay.
And yeah, so the periodontal pathogens grow back within 9 to 11 weeks. And so that's why we want to keep up with these maintenance appointments and keep the infection from progressing. And so for pain control for the appointment, we use a local anesthetic. And so we'll apply a topical first, and then we will inject half of your mouth. That's why we have two separate appointments, because we don't want your whole mouth numb. So we would just do the one side, and then it takes about 3 to 5 hours to wear off. And during that time, we don't really recommend eating after, just in case you were to bite or bite your mouth or your cheek. But if you do need something like yogurt or soft foods like that.
Yummy.
And then
also, what is the purpose of this local anesthetic?
Basically, it is used for the patient comfort. We want you to be as comfortable as possible, so that as a hygienist we can do the best job possible. And then it also for cutting down the appointment time as well, so you're not in pain.
Good.
And then another thing I recommend with the SRP is Arrestin placement. Have you heard of Arrestin before?
Mm-mm.
So Arrestin is a powder-like substance that will place in the base of the gum and between the gum and the tooth, and it dissolves over the course of 5 to 7 days. And we place it in pockets that are 5 millimeters or greater.
Okay.
It's great to use because it flushes out the bacteria, and it's something that you can't do yourself at home because it's so deep in there. So it's great to use.
Okay.
And then another thing I want to address is your oral hygiene habits. You brush twice a day, which is awesome and great. But I also recommend antimicrobial toothpaste. Crest Detoxify is a good one, or Crest Gum Detoxify, and then Crest Pro Health. These really keep the bacteria away as much as we can. And then an antimicrobial rinse like Listerine once a day. Is that an achievable goal, you think?
Yeah, that's not too bad.
Okay.
It's pretty easy.
And then recommending for sure flossing more interdentally. Yeah. So they have interdental brushes. You can use back in those molars where you have furcation involvement.
Is that the ones with the picks on them?
Yeah, or those work too. And then there's also the other brushes. Oh. They're a little bit bigger to get back in the furcation.
Okay. And then,
yeah, I encourage you to just keep up on those frequent care visits when you, especially after the SRP treatment is done. And then also, because you have such deep pocket depths back there, SRP might not be effective. We're going to try it. But if not, you might have to see a periodontist.
What's SRP again?
The treatment that we're doing for the 2 appointments to reduce the pocket depths and removing the tartar and buildup in those deep pockets.
Okay.
Yeah, so you might need surgery or extraction on those. So you might keep in mind that you might have to go there after SRP is done, just in case.
Okay.
You might not be able to save those teeth.
Okay. How much is all this going to cost me?
So for each quadrant, it's going to be $35. So for the whole mouth with SRP, it's going to be $140. Okay. And then also keep in mind with our clinic, the tissue check in 6 weeks and the Arrestin placement is going to be free of cost, which is an awesome, because at most offices that is not free, obviously. And then the perio maintenance visits every 3 months are $55. So.
Okay.
And then some other things to keep in mind after the SRP, you might experience some pain and discomfort, which is normal, and this can vary from anywhere from 2 to 3 hours to 2 to 3 days. And to eliminate some of that pain, I recommend ibuprofen, aspirin, Tylenol, any of the over-the-counter medications, and then warm salt water as well can help with the gum irritation.
Okay.
Do you have any other questions for me?
No, thank you for going over all this information with me.
Yeah, for sure.